The recent acknowledgments by governments worldwide, including the US federal government, about the harmful nature of certain injected products presented as vaccines mark a significant moment. These admissions of coercion and harm may have played a role in the failure of the World Health Organization's proposed pandemic treaty. Despite this global treaty failure, the coercion and the mandates and the harm associated with these practices are likely to continue on more local levels. To truly understand why, we need to take a deep dive into the prevailing misconceptions about the science that has been widely accepted for decades. The belief in the efficacy of artificially induced immunization has become entrenched in our culture, much like the once prevailing belief that the sun revolved around the earth based on the appearance that it does. When the latter was disproven, it initiated a profound shift in scientific and philosophical thought, challenging established beliefs and leading to a more empirical approach to understanding the natural world. A similar shift is necessary concerning the science of artificially induced immunization to prevent ongoing coercion and harm. The concept of injecting parts of pathogens or mRNA messages to make parts of pathogens, hoping to induce immunity, overlooks the natural process of how the immune system develops protection. In natural infections, pathogens enter the body through epithelial barriers, triggering a comprehensive immune response. This response involves not only robust Y-shaped serum antibodies, but also mucosal immunity, particularly secretory IgA antibodies, which play a crucial role in preventing infections at their entry points. When scientists inject parts of pathogens or mRNA instructions to produce pathogen proteins, the immune response is incomplete and often ineffective. Pathogens constantly mutate, and antibodies produced from vaccines may not recognize new strains, rendering the vaccines ineffective. Furthermore, the suggestion to inject non-mutating parts of pathogens fails because such antibodies would not neutralize the proteins on the pathogen that are used by cellular receptors to allow the infection to take place. Proposing to inject whole pathogens instead of their protein parts, trying to mimic a natural infection, poses significant risks. It is challenging to control the potency and safety of such preparations, potentially provoking the very disease they aim to prevent. Historical examples, such as the failed polio eradication efforts led by Bill Gates, highlight these risks. Additionally, injections fail to induce mucosal IgA antibodies, crucial for preventing future infections. Public fear of diseases is often driven by high mortality rates presented without context. These rates typically reflect the worst-case scenarios that involve severe cases without adequate treatment. This ignores the vast majority of the population that will experience mild or asymptomatic infections. Propagated fear is a powerful tool used to drive acceptance of vaccines, but this fear is based on incomplete and often misleading data. True protection against infections lies in understanding and strengthening the body's natural immune defenses, particularly at the epithelial barriers. Specialized immune cells guard these barriers, providing the first line of defense and can prevent infections from happening. In contrast, serum antibodies, produced in response to injecting parts of pathogens or mRNA messages to make these parts, play a role in adaptive immunity but cannot prevent pathogens from entering the body. Gaining knowledge about the body's natural immune mechanisms and the management of communicable diseases is crucial. With this understanding, people can make informed decisions about their health without succumbing to fear-driven coercion. It is important to know that all communicable diseases are manageable and treatable with proper supportive care, sanitation, and nutrition. A significant shift in consciousness is required to move away from the flawed practice of artificial immunization. As people become more aware of the natural mechanisms of immunity and the manageability of diseases, they will be less likely to accept injections that weaken their inherent defenses. This shift will lead to the rejection of mandated artificial immunization, fostering a more informed and health-conscious society. The journey towards this shift is gradual but inevitable. As understanding deepens, the reliance on artificial immunization will diminish, replaced by a more holistic approach to health that respects and harnesses the body's natural defenses. This shift will mark a new era in public health, free from the coercion and harm of past practices.